Welcome to Health Authority TV. My name is Devin DeVries. I'm the editor-in-chief of Health Authority Books, and our mission here at Health Authority TV is to bring together a community of health business experts and find out what's going on in their world currently and also look to the possibilities of the future. Today, our guest is Dr. Theresa Ashby, author of Better Implementation Now and Exposing the E-Learning Mystery. Welcome, Dr. Theresa.
Thank you so much, Devin. Thank you for asking me to be here. I'm so excited to have a conversation with you.
Yeah. Well, we would love to just start out and find out, who do you serve as a health authority?
Yeah, absolutely. Well, I come out of healthcare, right? I spent many, many years in a very large corporate healthcare organization. And what I saw is that there were consultants who were consulting to the healthcare organizations. And so I really wanted to help those consultants come in and be able to really service the big organizations in a better way, more efficient way. So I do a lot of work with consultants who are taking the time to make our healthcare better. And what I help them with is just looking at their business and saying, what do you need to digitize? How do you need to create efficiencies? How do you need to use AI? And while I'm helping those consultants look at those things, they're also helping the healthcare organizations look at those things. So it's been a fun journey to watch consultants grow their healthcare practice.
Hmm. And are there any additional services that you provide to these consultants in this area?
Yeah, absolutely. So when we're working with our consultants, we take a look at how their customer journey is. And then we say, how can we look at it and what can we digitize? So when we talk about digitizing, that's creating e-learning courses. How do we create e-learning courses? And that's why Exposing the E-Learning Mystery was such an important book. And then we take it and say, okay, if you have those digital products, how are you engaging with your customer? How are you making your business easier by automating a lot of these opportunities? And I think we take a look at people's outdated business frameworks and say, let's modernize it into this digital world.
Yeah, I think that one of the things I found interesting in your book was when you would talk about time and how finite of a resource that is. And
Yes.
that's the biggest challenge for really growing. And I think a lot of our authorities worry about, how can they get their important messages
Yeah.
out to a wider audience when they're so limited. So I
Yeah.
think your book has some really helpful tips on that. And we'll make sure that, both books are linked in the show notes if
Wonderful.
our listeners want to learn more about that, because I think it's very valuable.
Thank you. Yeah.
Okay, so now on to the meat of our discussion. Um, and this is the conversation that we want our community to really engage with. And so we're asking all of our health authority experts, based on your experience, how can we redesign America's healthcare system?
Yeah. Devin, this is such important work to really ask that question. That is a deep question, and I think just by asking it, we can help move us forward in the changes. I've, like I said, I've spent many years working for large corporate. I've spent many years in as a professor in the healthcare arena, and what I see is it's got such traditional ways of doing business. And while I'm gonna preface this, I know that there's policies, there's procedures, all of those things. However, I believe the way we're going to change this is by looking outside of the healthcare industry and saying, what are other industries doing better than the healthcare industry? And I think you have organizations that are more fluid, they're more agile. They can see where sometimes having not being so stuck in the tradition of how a patient enters into a hospital or how a patient comes to some kind of service. It's like, how do we take the opportunity to really, we talk about the patient journey, right? I talked about the customer journey. It's the same thing. It's you're looking at the patient, and the patient is not usually feeling all that well. And so
Right.
we take them through with speed and we're just pushing them through. And sometimes we have to take a step back. And we're also, think about, for me, I was in charge of my mother's health care. I am very, very busy. So how do we change those frameworks and create an opportunity for somebody like me, but really can still care for my parents and take care of them? And when I talk about this outdated framework, it's like if you create this innovative idea, we have to be open to trying it. And I think sometimes a lot of the answers we get is that's never worked before, so let's not do it. And that is where, if I can jump right into this, you know, the speed in which we're doing things, there's a way to do speed, and then there's the way to take care of the patient that's very humanistic. And that's where we're starting to get confused about AI, because people are saying, we're going to take the humanistic part away from us. No, let us use it to enhance patient care and still create that human aspect of it.
Yeah, that's a really interesting point, and I think AI is going to be a even bigger conversation
Yeah.
as we start to see in really all industries.
Yeah.
But
Yeah.
yeah, it could be a really helpful tool,
Right.
but it also has its
Yeah.
challenges.
And that's where the ethics comes in, right?
Right.
But if we say for the good, all right, and we're taking it, and I think too, we have an opportunity to leverage this before the patient even comes in. Like sometimes people are so nervous about their procedure or they're so worried about it that they literally cancel before they even get there,
Right.
right? And that affects the flow of healthcare, and that is a costly proposition. So it's those little things. So if we could do more education up front, and we can leverage some of the technology, right, or some of the e-learning courses, and we can really reach out to somebody like me who's a caregiver. Listen, when my mom was ill, it getting resources, and I've been in the healthcare industry.
Right.
like I like I've been there.
You
I
had a leg
know
up.
people. Right? Like I'm not somebody that's like I have no idea. It was still very challenging. And that's where we have to start looking at what's the challenge for our patients and for our caregivers and eliminate those challenges. And we can leverage some of the digital products we're able to do. I also, we have to remember there's this emotional component. And coming out of COVID, things have been very hard for our caregivers and
Yeah.
for our physicians and any kind of practitioner. And so how are we taking care of them? I worked for a very large healthcare organization, and I will tell you, we had an unhealthy workforce because we drove them. And so we need to take care of our workforce. We need to take care of our caregivers. And we can do this all by leveraging different frameworks, by leveraging IT, by leveraging AI, by leveraging digital products, and being more open to truly changing things. And as I said, looking at some of the outside industries of what they're doing.
Yeah. Well, I think those are some really interesting ideas and things that we could explore more.
Yeah.
So thank you so much for sharing those insights. And for our community, we really would like to hear what you think and your ideas and thoughts. So please leave those in the comments, and we will see you next time. And until then, may you be healthy, wealthy, and wise.